Hi, I'm Melissa Howell with the Oklahoman, and I am here with Becky Odell and Ann and Hugh Benson. And we're going to talk today about Parents Helping Parents. It's an organization for parents who are dealing with addiction issues in their families. So Becky, kind of tell us a little bit about the organization. How many chapters do you have?
Well, Parents Helping Parents, Inc. is the parent organization. It's for chapters in Oklahoma. Our most active chapters right now are in Edmond and Norman, and we're working to build other chapters in the state. We're looking at Tulsa. We're over in Enid. We've done some things and still hoping to make those fly in Shawnee. We've been around for about 13 years. We've been really busy, I'd say, for about the last 2 or 3 years. And we're there for parents who have children who are struggling with chemical addiction of any age, and we're there for them with resources, with hugs, with whatever they need to make the right choices and to take care of themselves. And that is the most important thing, is helping them take care of themselves, because they can't help their children until they help themselves.
Yeah. You just said something that made me wonder. You said you've been really busy the last couple of years. Are you seeing an uptick in parents who are needing help, uptick in the number of
requests for chapters? We have seen a little bit of an increase in that. The attendance has been up a little bit. And as an organization, as the parent organization, we're just getting busy and growing and building, and all of a sudden the potential to grow has been amazing, and that's what we're working on now.
Okay. So here we go to the Bensons. You guys have had this experience. Tell me kind of what it's like. What is daily life like?
You know, just in a nutshell, when things do start to hit home, we're very confused. And then when we get to the point that things are where it's no longer deniable, there's some use or experimentation going on, we withdraw into shame mode, where we feel more like this is a reflection of our own parental failure. We tend to hold up that mirror and see ourselves rather than seeing our child, and really working in a proactive way to address issues. We also have a tendency to think, I think, in Oklahoma, but around the nation, we value our independence and our ability to solve problems, to pull ourselves up by our bootstraps and contain and take care of things. But substance use disorder is a disease. It may start with some experimentation or a choice to pick up a drink or a drug, but when it transcends into full-blown addiction, that's a chronic brain disease. And if our child had cancer or diabetes or any other kind of life-threatening condition, we wouldn't be thinking, we got this, we'll contain this ourselves. We'd be reaching out for the best help. Our neighbors would be bringing us casseroles and supporting what we're going through. None of that happens when your child starts struggling. So as parents, we isolate, we feel like we're being judged, like this doesn't happen in our family, this is some other family's problem somewhere else.
Mm-hmm.
It's important for all of us to know that we're good parents with good kids that have a disease, and we need help. Because the shame and the isolation that Ann was talking about is just both the user and the people who love the person using. There's this shame and stigma and stuff associated.
I imagine it's just kind of a loop.
Yeah,
at
right,
some
sure,
point.
right,
Yeah.
right.
So was there a aha moment for you where you thought, okay, our lives are going to change forever now. We're going to have to do something, or was it more of a gradual thing? Or?
I mean, I just think, you know, if I knew so much, why was I here? You know, I mean, I think it's just part of being a parent that you think you're supposed to be the one to know how to take care of your kids. right? You're supposed to know what to do. That's your responsibility. You're supposed to know what to do. And so it's really hard when you realize you don't know what to do. And then, I mean, first, that it's accepting you don't know what to do, but then it's even harder to admit that, right? To say that to somebody else, I don't know what to do, right? I won't ask directions how to get someplace. So how am I going to ask somebody how to help me raise my kids, right? I mean, that's a whole different issue, right? So it's just, for me, it's just letting parents know they're good parents who have good kids. They go to good schools. It's not like, oh, you just send them to some other place, or they go to a different school, or they go, they have the wrong friends. They're good parents with good kids who need help.
So what can the community do to help parents in your situation? How can the community come alongside you and help you with the burden that you carry?
Well, I mean, there's all kinds of ways they can help. I mean, there's the big way they can help, which is fund substance use treatment, right? Ann knows these numbers. There's something like 700 to 900,000 people who need access to substance use treatment in Oklahoma. And 1 in 3 can get access or get access. And the big problem with substance use treatment is the expense, right? Most of it is privately funded, and insurance doesn't, even though there's supposed to be equity, insurance doesn't pay so there's all those sort of big political-ish kinds of issues that the community can help with. Just recognizing that this is a disease and not a moral failing, right? It's not, if you should, any parent who's dealing with this will tell you, when I say this, they're gonna nod their head yes. Everybody is hurt. Well, you just need to ground her, right? And you just, so just understanding that there's sort of knucklehead use and experimentation, and grounding is sufficient. And then there's not, when that's not sufficient, and being aware of that. So there's that. There's also just awareness, right? Being aware, both being aware of the issue, being aware that how parents are dealing with this, how kids are dealing with this, and being aware that there are resources. Being aware that one of the things, we've been doing this for a long time, and I'll just tell you a quick story. I once got a phone call from a police officer. I'm a retired ancient Greek philosophy professor. Okay, that's what I do for my living, or did. And I got a phone call from a police officer asking me where to take an adolescent for detox, right? Now, this was a good police officer reaching out for help. But why were they calling an ancient Greek philosophy professor, right? And what it is an example of there are resources. What we can do is try to get those resources, get people to be aware of those resources and get help before it's too late. There aren't enough resources, but there are resources that they can access. And one of the things that Parents Helping Parents, one of its really valuable services is just being aware of those resources. So when parents call, we can give them some phone numbers to call where people who know stuff, not people, not an ancient Greek philosophy professor, but people who know stuff about this disease can help. Right? So those are what, just being aware, supporting mental health and substance abuse treatment, and working on the shame and addiction. Give a parent a hug, bring them a casserole, and instead of, I don't want my kids hanging out with your kids.
We live in an incredible time because we have the benefit of the science. And they have shown now through the research, through the scans, through all the information, what happens in the brain with addiction, which we didn't know 50, 100 years ago. And thus these these ideas of moral failings and all that. We know those are archaic concepts now. And yet our primary mechanism for dealing with addiction is still the criminal justice system. And I heard somebody speak a while ago talking about that, and they put out a challenge, and they said 100 years from now, when generations look back at us as the generations that really understood the science, how will we be judged knowing that this is how we processed and dealt with people that were suffering, that we criminalized them, rather than to provide resources and support and help for treatment. So again, you know, as communities, supporting legislators and having open discussions about how this is impacting so many of us. 1 in 4 families are impacted by somebody's substance use. This is not some marginal issue.
Well, and just real quickly, we mentioned, you talked a little earlier about your coaching program.
Yes.
Yeah, so if you could just tell us a little bit about that, that'd be great.
I just wanted to briefly mention, through our journey with Parents Helping Parents, we got connected about 4 years ago with the Partnership for Drug-Free Kids, the national organization. They started a program that's a parent peer coach program. It's a phone-based program. It's available nationwide. It's available to all Oklahomans. You call a toll-free number. It's 1-855-DRUG-FREE, which again, it's 1-855-378-4373.
Okay.
A social worker will screen that person to make sure their family is the appropriate fit for the program. It's really geared towards when a struggling person's 30 or under. This family will receive totally free 5 phone calls over a period of 5 to 6 weeks from a parent peer coach.
Okay, so Becky,
Yes.
Executive Director,
Yes.
tell us how we can, if a parent is interested in finding a group, or how do we get in touch with you?
They would just need to give us, they can visit our website at parentshelpingparents.info, or they can give us a call at 405-562-0964. That's our main number. If they're looking to talk to another parent, I'll connect them up with a parent. If there's a community out there that has some interest, or 3 or 4 folks in a community, any community that have some interest, we'd love to talk to them about setting something up for them there. You had mentioned, and they answered it so well, you know, what can the community do to help?
Right.
Just carrying on the conversation so that it's okay for people to talk about this, and to talk about how they can help, and to talk about how they can get help. That helps more than you can imagine. So just keeping the word out there, making it okay. I can't tell you how many parents I've had when I've walked into meetings who are fairly new, and they say, I had no idea there was something like this here for me. So it's a big deal to be able to walk in where there are other parents going through what you're going through, and no judgment.
Right.
And people don't ask last names, and people don't care who you are. They're there to be there for you and for themselves, and just be there to be loved and to love.
Awesome. Okay, so what's that number again?
That number is 405-562-0964.
Okay, and Ann, what's your number again?
1-855-DRUG-FREE.
I just want to say thank you guys for coming in on this wet day. Be safe out there. And I'm Melissa Howell with the Oklahoman.